This is Jessie
and Elena
from the Spring 2016 Seminar in Physiological Psychology. Today we'll be providing a brief overview of our topic for this class, abusive head trauma and its impact on the developing brain. In this brief overview, we will discuss the basics of abusive head trauma and some common injuries that are seen following abusive head trauma. Early childhood is a critical time in a child's brain development. It's also the time in a child's life when they are at the greatest risk for abuse and neglect. Abusive head trauma is defined as an injury to the skull, brain, and spinal cord as a result of shaking and/or trauma to the head. During abusive head trauma, the baby's brain hits the skull and small blood vessels between the brain and the skull can tear and bleed. Large blood clots can form, pressing against the brain and causing massive swelling. The baby's undeveloped neck muscles and the large head-to-body ratio offer no resistance to the shaking. The rotational impact, acceleration and deceleration, and impact of the brain against the skull can cause considerable negative consequences. Even 4 or 5 seconds of shaking can cause significant injuries, long-term mental and physical problems, and death. So, what goes on in the brain after abusive head trauma in very young children? There are 4 common injuries that we will briefly review. First is a subdural hematoma. Subdural hematoma occurs when traumatic inertial brain motion forces the cortical surface to detach from the skull and the dura mater, creating bridge vein tears. This means that a pool of blood develops between the brain and its outermost covering. The second injury we'll discuss is a retinal hemorrhage. About 65 to 89% of abused children have retinal hemorrhages, which are flame-shaped, multi-layered, and diffuse. Rotational forces seem to cause these injuries rather than an accidental head trauma like falling. Next, there are cervical spinal injuries, which can lead to focal axonal damage to the brainstem and spinal nerve roots. Cervical trauma can also cause cardiorespiratory arrest or apnea, which results in hypoxia and brain swelling. Finally, severe seizures are common and are correlated with poor neurodevelopmental outcomes.
In this image, you can see the difference between a typically developing baby's brain on top and a baby's brain post-abusive head trauma. In particular, the brain is swollen and there are clear subdural hematomas. Although this has been just a brief overview of the impact of shaken baby syndrome, it is clear that prevention is critical in order to have safe and healthy kids and families. First, it is important to never, ever shake a baby. If you are in a situation where you feel overwhelmed with the demands of caregiving and you are not able to control your behavior, place your baby in a safe place like their crib and walk into another room until you are calm. More broadly, prevention on a public health level must focus on educating new parents about the risk for abusive head trauma and giving them alternative coping strategies to deal with stress and the demands of parenting. For more information, please go to the website for the National Center on Shaken Baby Syndrome at www.don'tshake.org.